There's a growing tension in Ipedumodu, Osun State, as the Abetu of the town, Oba Joseph Oluyede, faces possible prison sentence in the United States after pleading guilty to COVID-19 relief fraud. The hometown of the Nasarawa State Governor Abdullahi Sule, charcoal sales are booming despite the state government ban. Good day, viewers. Welcome back to DDM House News Update. On our program, your health, your wealth. Hope you had a lovely weekend. As usual, I often remind you guys to subscribe to our YouTube channel, Dash Route Digital Media, to get the latest on health. Well, the federal government, through the Federal Ministry of Education on Monday, that is today, announced the surge in enrollment into nursing programs. The ministry said the country reported an increase from 28,000 participants to 115,000 participants annually. Wow, what an increment. A statement signed by the Director of Press, FME, Folasade Borowu, said the development is a testament to the promise of the current administration to transform healthcare education. The statement reads, in a groundbreaking leap for Nigeria's healthcare and education sectors, Nigeria has reached a transformative milestone in healthcare education. Annual nursing enrollment has surged from 28,000 as it was on May 28, 2023, when President Bola Ahmed Tinubu-led administration was inaugurated, to an unprecedented 115,000 as a result of Mr. President's initiative. You can imagine that. The Honorable Minister of Education, Dr. Maruf Olatunji Alusa, reaffirmed the federal government's commitment to President Tinubu's renewed hope agenda, focusing on revitalizing the education and health sectors. This is wonderful. Well, in line with the administration's emphasis on science, technology, engineering, mathematics, and even medical sciences, the Federal Ministries of Education and Health and even Social Welfare, under the leadership of Dr. Alusa and his counterpart, Coordinating Minister of Health and Social Welfare, that is Professor Muhammad Ali Pate, have successfully surpassed the initial set-out target of 110,000 nursing students annually enrolled at our nursing colleges to 115,000. Doesn't it require an upload for them? The Honorable Minister thanked stakeholders, industry leaders, the Nigerian Council of Nurses and Midwifery, teaching hospitals, and ministry staff for their contributions towards this great achievement. This increased enrollment capacity signals a transformative era for nursing education in Nigeria, positioning the country to meet domestic and global demands for qualified healthcare professionals. Or don't you think so? Well, up next, a measles outbreak has been recorded in Ugunga Kanawa community, Tankoru, Dusenaba in Zaria local government area of Kaduna State, claiming the lives of at least 5 children and leaving many others bedridden. The outbreak has been linked to widespread vaccine refusal due to misconceptions about immunization among villagers. Oh my goodness. According to the village head of Ugunwa Kanawa, Nasiru Unasa, 2 children from the same family died just 7 days ago. Unasa attributed the death to the community initial reluctance towards vaccination, saying 2/3 of our people didn't like vaccinating their children due to misconceptions. Oh, so sad. But now, many are changing their attitude because of the sicknesses and deaths we are witnessing. Of course, they should. The village head lamented the lack of healthcare facilities in the area, noting that the nearest primary health center is about 7 kilometers away. Oh. We may now deliver at home because there is no clinic here. We are appealing to the government to provide a health clinic for us, he pleaded. Please, government should take note. A housewife in the community, Saude Zafianu, recounted her tragedy, having lost 4 of her children to preventable illnesses. We didn't vaccinate our children, and we didn't take them to the hospital for immunization because my husband didn't approve it. This is how I lost 4 of my 6 children after the first child. But I later understood the importance of vaccination. Please do that. So I begged him to allow me to vaccinate the last girl I gave birth to. And now she's very healthy, she said. You can imagine. Zafinuya noted that resistance to vaccination was only widespread among men in the community. But recent experiences were shifting opinions. Wow. In the past, our men always opposed immunization. But now, their mindset is changing after many children fell sick and some died. They're urging women to ensure their children receive life-saving vaccines. Please don't resist it. The Kaduna State Primary Healthcare Board has confirmed the outbreak and intensified routine immunization efforts as a key strategy to reduce maternal and child mortality rates. The Director of Disease Control and Immunization at the board, Hamza Ibrahim Ikara, said, "In response to this outbreak, I have directed the local government surveillance officer to strengthen surveillance." We are covering all communities within Ugwanwu Kanawa to ensure no child showing symptoms is missed. Wonderful. Ikara explained that outreach teams were visiting households to administer vaccines and has secured the support of male heads of households, a crucial step in communities where women often need permission to vaccinate their children. So he said, "Today by 4 p.m., our vaccination teams will visit the community to carry out vaccinations. Our goal is to quickly stop the outbreak within this community and across the local government area." Wow. UNICEF Chief of Field Office in Kaduna, Dr. Jerida Birikula, who visited the community as part of the vaccination week and polio vaccination campaign in collaboration with the state government, expressed concern over the high number of unvaccinated children. 3 years ago, this community had 100% refusal for vaccination. Now, as you can see, several children are suffering from measles, she said. Birikila praised the efforts of religious and traditional leaders in encouraging immunization acceptance and called to continued support from all stakeholders. So we appeal to parents, community leaders, the government, and partners like UNICEF and WHO to encourage the uptake of immunization. Many illnesses are now appearing because children are either not immunized or not immunized on time. So the current vaccine shortage in the country poses additional challenges, according to Birikila. So we are trying to find vaccines for measles amid national shortages. It's crucial we secure predictable vaccination supplies to protect the children, she noted. Furthermore, the United Nations Children's Fund, in partnership with the Bauchi State Government, has mobilized traditional rulers to ensure massive 2025 polio vaccine uptake and compliance in the state. Speaking during the monitoring of the vaccination exercise in Ningi local government area of the state on Saturday, Chief of UNICEF's field office in Bauchi, Nuzat Rafik, lauded the participation of the emirs in the advocacy of the polio vaccine uptake in the state. You can imagine emirs partaking on that. Well, represented by Eki George, UNICEF social behavior change specialist, Rafik acknowledged that the role of the traditional rulers would play to ensure massive vaccine compliance and uptake could not be overemphasized. She explained it is a welcome development to see our royal fathers taking up the leadership role in leading our communities to do the right thing. Wonderful. We are indeed very grateful as we have sought for their roles in this campaign, and here they are with us to ensure that our children are vaccinated. Wonderful. We appreciated the presence of the traditional rulers during these monitoring exercises, and this will definitely encourage and boost the uptake of the polio vaccine, especially by the non-compliance people in the state. This is a campaign where we want to ensure that all the zero-dose children in the state receive the life-saving vaccine, as well as ensure that the parents, especially fathers, continuously give consent to their children to be vaccinated. Rafik expressed UNICEF's readiness to support all the local government areas, the communities, the states at large in ensuring that all the qualified children are vaccinated and kick out polio from the state and Nigeria in general. Also speaking, the Emir of Das, Usman Bilaminu, said that the traditional institutions in the state are very committed to ensure that polio is completely eradicated in Bauchi State this time around. The Emir, who is equally the chairman, Bauchi State Emirate Council's Committee on Health, explained that the traditional rulers would be fully involved in the mobilization of communities, especially the non-compliance for the vaccine uptake. He said, there are many communities here that are very known for non-compliance of the polio vaccine, and that is why I and the Emir of Ningi have decided to visit the communities by ourselves. Please, if you're a victim, try to comply. We are here to sensitize the people of these communities to ensure that the health workers can be able to access each and every household to be able to vaccinate all the eligible children in these communities. He emphasized they had been working closely with some malams and imams who had been resisting the vaccine in the past, adding that they have all accepted it. Wow! It's a very good effort, of course, and inshallah, we are going to see successes because the issue of resistance is now being taken care of. Even those imams that were resisting to some extent before then are now with us. And one of them just did a symbolic vaccination of some children. He stated, on his part, the Emir of Ningi, Haruna Danyaya, who is the charge of Gadamiawa, a community where the take-up was launch pledge commitment to communities with record of non-compliance. So he warned that whosoever is found wanting will be punished. It has been more than a decade since we have been into this struggle. So finding health to our people is not a negotiable thing. Of course, it's not negotiable. Please try to comply in order to be vaccinated. It is a must do, and every hand must be committed so that you can save your child. Well, finally, the Minister of Women Affairs, Iman Suleiman Ibrahim, has disclosed that over 80,000 Nigerian women die from firewood and traditional cooking stove toxins annually. The minister described the situation as social injustice, adding that the ministry would spare no effort in ending premature deaths caused by firewood and traditional cooking stove toxins. God help us. Suleiman Ibrahim disclosed this at a multi-stakeholder engagement in Abuja. The event, organized by the ministry, which had the theme Powerhouse 774, End Energy Poverty for Women. No be small thing. She explained that with the right collaboration with relevant ministries and agencies, the initiative would end energy poverty for Nigerian women. Each year, some 80,000 Nigerian women die prematurely from toxic smoke emitted by firewood and traditional cooking stoves, she revealed. According to her, the ministry will provide access to energy through solar home systems, clean cooking technologies, solar water pumps, e-mobility tools, and other productive use appliances in every corner of this nation. Okay, let's hope on that. Today, we begin stakeholder engagement to eliminate energy power for women in all 774 local governments. We will deliver life-changing energy solutions across the country, she added. The urgency could not be greater. These 80,000 women are not statistics. They are mothers, providers, even nation builders. Their deaths are avoidable, unjust, and must end on our watch. Energy poverty is not just a technical challenge. It is a social injustice. It locks women in cycles of unpaid labor, economic dependence, and even health risks. In many communities, women spend up to 8 hours a week gathering firewood. She explained that her ministry would collaborate with other ministries, financial institutions, local manufacturers, global tech firms, women's cooperatives, and development agencies. We are connecting policy to people, innovation to impact, and gender to growth. This is our moment. This is our mission. It is women o'clock. And this is the energy poverty revolution we have been waiting for, Suleiman Ibrahim explained. On his part, the Minister of Power, Adebayo Adelabu, retreated the federal government's commitment to stabilizing the power sector by empowering 3 million Nigerian women. He lamented that energy scarcity also limits women economic opportunities and access to productivity-boosting tools. Between 2025 and 2027, we will empower 3 million women in all 774 local government areas with clean energy solutions, Adelabu said. Adelabu also said in his ministry that they will deliver these technologies enough to the Rural Electrification Agency. Okay? The Ministry of Power via REA is already rolling out people-centric projects. We are expanding access through decentralized renewable energy systems, solar home kits, clean cooking initiative, and productive appliance for homes, small businesses, and farms, he said. On his part, the Managing Director, Rural Electrification Agency, Abba Abubakar Aliyu, said under the $550 million Nigerians electrification project, about 8 million Nigerians and 35,000 businesses were impacted, out of which 12,000 were women-led businesses. This is serious. According to him, President Bola Tinubu approved $750 million for grid projects, out of which $410 million have been earmarked for mini grids and $240 million for solar home systems. So, there is a huge opportunity for us to replicate and to make sure that we scale this intervention across the country. This is what Abubakar Aliyu said. So please, have hope that maybe by 2027, the elimination of cooking with firewood will end and our women, our mothers will be safe. Well, viewers, with this, we come to the end of today's program on Your Health, Your Wealth. So do ensure to click on the like button, share, comment, and subscribe to our YouTube channel. That is the most important. Subscribe, drop your comment. Our YouTube channel, that is Diaspora Digital Media, popularly known as DDM. Until next time I come your way, I remain your host, Nenyo Michael Inezimi. Do have a wonderful day. Bye for now.